Hi everyone, my name is Mariel Lorenz and I am the Carrie Line Supervisor here at CARIE, which stands for the Center for Advocacy for the Rights and Interests of the Elderly. And I just wanted to thank you for joining in on this webinar presentation on long-term care options. This is part of the education that we're trying to do with our Elder Homelessness Project here at CARIE, and I'm happy to, have you all learn about long-term care options for older adults, and it also can apply for those who have significant disabilities as well. And here to co-present with me today is Nicholas Clemens, who is the Elder Homelessness Advocate here at CARIE. And so we're just going to be going through today the options that are available when it comes to being cared for in the community for those with chronic conditions, and also that have affected disabilities and whatnot. And Nick will be getting more into those, and then I'll be talking later on about the settings where people can get this type of care. So, Nick, I'll let you take over then.
Again, I wanted to thank everyone for taking a little bit of time to familiarize yourself with some of the long-term care options we're going to talk about today, and as well as how this may apply not just to traditional long-term care settings, but also at risk for homeless populations, or how some of this may overlap with the homeless supports community. We're going to start today kind of with talking just briefly about who CARIE is and what we do, just to kind of make sure that you're aware of the kind of resource that we'd like to be for you. And then we'll also speak a little bit about the different long-term care options, both for the aging population as well as individuals with disabilities. And then kind of how the costs come into that, both for the individual and for the state. So we'll kind of get right into it here. So CARIE, as Mariel mentioned, stands for the Center for Advocacy for the Rights and Interests of the Elderly. We are in our 40th year, or I guess we're rotating into 41st at this point. But nonetheless, CARIE offers kind of a litany of programs designed to help the aging population here in Philadelphia as well as throughout the state. Kind of our flagship program, for which both Mariel supervises and myself, I'm also involved with, is the Carrie line, which is a assistance and referral line that's operated here every day at Carrie. We receive calls throughout the state and provide individuals with targeted information and direct assistance, and help field concerns they may have, and find them avenues to mediate that or to assist them. We also provide here at CARIE the PAVE program. It's a program aimed at assisting victims of crime in the elder community here in Philadelphia. The service, they'll accompany individuals to court, assist with claims for compensation, things like protection orders, and provide additional supports to people who are working through the court system here in Philadelphia. We're also home to the state's Senior Medicare Patrol Program, which is a federal program that's aimed at educating seniors about how they can protect themselves from fraud, largely through Medicare, Medicaid, and insurance. And then most recently, kind of as an addendum to the CARIE line, we've been looking at kind of exploring the overlap between, or the intersection rather, between the aging population and the homeless and at-risk homeless community here in Philadelphia. And so that's part of where this comes into play, is kind of wanting to make sure that these resources, some of the resources that are available to the older population are that people working with the at-risk and and in Homeless Supports Program have access to both a referral source, an information bank here at CARIE, as well as are aware of kind of some of the services that are out there for long-term care. So kind of one of the crux that we always like to bring up about CARIE is we consider ourselves, since we are an advocacy organization, we kind of base everything on something we call the circle of advocacy. It's basically, you can think of it as a circle, you can think of it as 3 legs of a stool, but essentially we take things that we immediately see on the ground level, a case-by-case basis, or a referral or a telephone call that comes to the CARIE line, an issue, and that informs kind of the decision-making that we make. And then through kind of a broader scope of advocacy, we use that information to kind of scale that up, to build solutions, to speak to policymakers, to advise on matters that are important to seniors. And then the whole process starts back over. So it allows what we see kind of day to day in the conversations we have with people in senior centers or over the CARIE line or at community civic centers or health fairs, the questions that we get and the concerns that we have, we carry that into our policy wing and our broader scope of our programs to make sure that we're addressing those issues, not just on a micro level, but also on a macro level. So to kind of get into some of the meat here today, we're going to talk about a little bit, just a brief introduction to the types of long-term care that exist. So most commonly, we refer to long-term care as in-home support services. There's also life programs, which we can explain a little bit, domiciliary care programs, personal care homes, assisted living facilities, nursing facilities, and kind of what some of the nuances are of these, as well as things like adult day centers, which you may or may not be familiar with. Just to give you a short introduction, because I think we'll explore some of these in a bit deeper later on. In-home support services are traditionally kind of considered home and community-based services. These are services that you'd be able to receive in the community without having to go to a facility or center in most cases. So that could mean aid service in your home and things of that nature. That is, and in many instances, that can be brought into a shelter system or short-term living facility. There have been some instances of that, and that is available in some cases to individuals who are living in transitional housing and things like that. The LIFE program, which the acronym almost always eludes me, but I wrote it down. So it's Living Independence for the Elderly, which is more of a managed care model of long-term care that kind of encompasses a whole structure of both living as well as medical care. But we'll get a little bit into that. Domiciliary care or DomCare is to provide kind of structural home environments for adults over the age of 18 that need assistance. Oftentimes this is for people with some form of disability. They may require supervision and support in a more traditional home atmosphere, which they may not have access to. Personal care homes, general homes that provide shelter, supervision, assistance with some ADLs and IDLs, which are things we'll talk about in a little bit. They're typically for older adults or individuals that have cognitive disabilities. Assisted living facilities, also kind of along they're generally for older adults. They're centers that provide some level of independence in their living environment that can help with certain activities of requirement. And then there's nursing facilities, which I think people are most commonly familiar with, which in most cases provide both a home atmosphere or a living arrangement rather, and skilled nursing care, or generally provide skilled nursing care. So for most of these, if not all, the process for exploring long-term care for an individual starts with an assessment. In many cases, this assessment for an older adult would begin through a discussion with the AAA or some other referral source, but would end up with an assessment. And what an individual will do is they'll come out and they'll actually provide, do an analysis of the individual in question's abilities or lack thereof. It should be noted that the individual that will be doing the assessment is in many cases not a medical professional, generally not a doctor. They are trained in doing the assessment, but they aren't a medical professional. In most cases, not in most cases, but in many cases, the assessments are reviewed by a registered nurse and would be accompanied with some discussion with an individual's doctor, but the actual person providing the assessment is oftentimes not a medical professional. So if you have specific medical questions, that would best be addressed with your doctor or physician. So when someone comes out to do an assessment, what are they actually looking at? They're looking at something that's traditionally referred to in this area as activities of daily living, or ADLs. And that's just a really fancy term for things that we do every day that an individual would need to be able to do to live independently and safely. So kind of the laundry list here, the main guys that come up are bathing, dressing, grooming, incontinence, toileting, eating, and transferring. Just a brief description if anyone's. So there are, in most cases, there's a sliding scale of one's ability to do these things. So while an individual may be able to physically bathe themselves, it'd be worth noting whether or not they're capable of safely getting in and out of a bathtub. Or in the case of dressing, they may be able to put on a shirt, but are they capable of putting on socks and shoes? Incontinence, they may be able to most of the time make the lavatory, but do they also use incontinence supplies like adult diapers and things like that? So this is the type of information that the person that's doing the assessment would garner and glean from the family as well as the individual, and then use it to kind of build an analysis of the person's total ability. Okay. One of the ones that's also very difficult for people to kind of wrap their mind around is transferring. Transferring, as it's defined, is the ability to get in and out of a chair or bed. Most oftenly, it's not so much whether or not an individual can get in and out of a chair or a bed, it's whether or not they can safely do that. Whether or not shifting balances puts them at a significant falls risk and things like that. What goes along with the ADLs is a second fun acronym, which is called the Instrumental Activities of Daily Living, or IADLs. These are essentially secondary activities that are also help paint a fuller picture of an individual's needs and abilities, but are kind of viewed as or weighted differently than those primary ADLs, which hold the most weight. So IADLs are things that are more closely associated with making not necessarily necessary technically, but make life easier and independence easier for an individual. So this is a lot of that stuff that when you think of a family member who's caring for an individual, it may be things that come to your mind as far as a family member preparing a meal, keeping the house free of clutter, doing laundry. Things that an individual who's reasonably healthy or reasonably healthy may be able to feed themselves, they may be able to get out of the shower, but negotiating stairs and holding a laundry basket and taking the laundry in and out or washing clothes and meal preparation may not be something that they're capable of doing. Maybe they can't stand for long periods of time. Maybe there's certain memory issues, and meal preparation can be a risky proposition for someone that maybe isn't capable of remembering whether or not the stove is on. So these activities are more closely related to things that would make life easier for an individual, but aren't considered necessary daily activities, things like bathing and eating and dressing. but still very, very important to an individual's general independence, especially when you're talking about meal prep and transportation and general cleanliness and things like that. Okay, so why do we use and when does in-home support come into play? This is the first form of long-term care that we talked about. So individuals have access to long-term or in-home support through a few different ways. In some instances, it can be paid for by insurances and even Medicare as well as Medicaid for short stays, as well as longer-term situations, oftentimes under what's called the Medicaid Waiver Program. But to kind of just break it down, there are plenty of instances where people will use in-home support services shortly after a hospitalization to kind of help their recovery process. They've been in the hospital, they maybe even gone through rehab, and they're returning home. And so now this gives them an opportunity to kind of ease back into home while having maybe an aide come out or a visiting nurse come out to kind of check in and assist briefly. As I said, these are generally done at home. These are generally provided at home, although there are certain centers or facilities called adult day centers that can also provide these types of services. I think Mariel will have a chance to talk a little bit more about that. And the aim of in-home support, the way it's always kind of been fleshed out, the aim of in-home support is to specifically assist with those ADLs, those activities of daily living. So again, and to remind you, that's eating, that's dressing, that's bathing, that's toileting, transferring. Those activities that can be dangerous for an individual for falls risk, can be dangerous or can be a choking hazard, things like that. That's the aim of in-home support, is to mitigate the risks associated with that and also help provide those services to the individual. Some of the groups that provide these types of things, it should also be mentioned that in-home support isn't just limited to ADLs. In some instances, you may have registered nurses actually come out and provide blood work, do just quick vital sign checkups for the primary care physician. Commonly, you'll also see PT or physical therapists, and occupational therapists come out to the home to do follow-up post-rehab to make sure an individual knows how to utilize new equipment they may have got, or can teach them how to use a shower chair that will help mitigate some of the risks associated with bathing, things like that. As well as there are companion programs available in Philadelphia and as well throughout the state where you'll be able to be paired with an individual. And most times these are not trained and they're often volunteers, but they can help provide some of those secondary assistance, not just companionship, but also maybe help prepare a meal and just declutter a little bit. Lastly, home-delivered meals is a very popular program here in Philadelphia as well, to assist in many cases with people who aren't capable of fixing a meal. The meals come basically ready to heat up and eat in your oven, and they're delivered to the home in most cases weekly. Lastly was kind of the last category of people who will assist with in-home support, kind of ones I referred to initially, and this is home health aides. These are trained individuals that are through licensed and bonded organizations throughout the city that are trained to provide assistance with ADLs. And those, again, that's that grooming and bathing and toileting, et cetera, those specific tasks that are aimed at assisting in preventing risky behavior. Specifically, a lot of times you'll have people ask why their home health aides don't clean their bathrooms or take out their trash. And it's worth oftentimes reminding people that sometimes those activities will get done in passing by a home health aide, but their primary job, again, in the state of, as kind of decreed by the state of Pennsylvania, is to assist with those activities of daily living. So they're kind of in review. There's a lot of in-home support options out there. Some of them more evasive than others. And there's also options for people who need, there's medical-based options, as well as options for people who are just looking for maybe companion services where they may be able to assist with activities around their home while providing, things like emotional support and things like that. Those are referrals that can be made to organizations within the city. And can be very valuable to people in their rehabilitation or in their long-term care, and their long-term care needs. So this is additional types of what kind of comes along with in-home support care. So chore services are a little less common in Philadelphia now through some of the major players. But extermination is still viable. It's still a big one that can be paid for through many of the Medicaid programs. There's kind of goes along with friendly visiting that kind of also falls under the companion services and telephone support services. Adult day, which I think will get talked about a little bit here. Hospice care, which I didn't mention, but does provide end-of-life care in the home, and that would be medically based. It is it is paid by the state and federal, and it generally is a 6-month window that you would have to be certified by your physician that the individual has reached a 6-month window for end-of-life services. And then when we refer to informal support, that's traditionally a family member, a friend, a neighbor, or some other form of extended relative or individual that comes and provides services in the community, but outside the scope of any kind of formal care plan. So that could be a daughter that comes and cooks meals for an individual, or a son that provides transportation support. So there's kind of a mixed bag and a lot of different areas covered under in-home support for community-based services. And they do a lot of different types of things. And while we'd love to be able to run down a litany of different providers for all these, there are a lot of referral services that can be made given in different situations. We just want to make you aware of what's available to individuals and how varied they are. So that you can look for opportunities where in the in-home support community where we might be able to find ways to support the aging population in general, but also people who are at risk or facing homelessness. And I think Mariel was going to talk a little bit about some of the facility options. So this would be stepping outside the community and actually moving towards a facility placement. Mariel?
Yes. Thank you. Thanks, Nick. So I'm going to be talking more about receiving long-term care services in facility settings. Now, some of these are a mix of community and facility type setting, like the life care, and I would consider it that as more of a community-based type of service. But the other types of facility cares, like DomCare, personal care boarding home, assisted living, and nursing home, these are services, and I would say the settings go from least restrictive to more restrictive in terms of how the settings are. So I'm going to talk a little bit about each of those. And going into DomCare, DomCare stands for domiciliary care, and the DomCare program is, I think, the simplest way without simplifying it, is thinking of it as a type of adult foster care. Oftentimes um, it is their service is similar to a personal care boarding home, but these are individuals who are, and they're licensed. They are licensed by, I believe, the Department of Human Services. These are individuals who have decided that they wanted to open a room or two in their home to care for an individual. Typically, those residents in DomCare are 18 and over. They may have a intellectual disability. They may have, or they are older with mental health issues, or they have cognitive issues as well. It's a little bit more personalized than a boarding home. This is a home where you may have one or two folks who are living in a DomCare home. It's been kind of interesting to see that in this area in Philadelphia County, this is a program that is thriving very well. But when you go to other parts of the state, it's not as you don't see this as much. But if someone is interested in becoming a DomCare provider, I believe that they could contact the local area agency on aging, which is Philadelphia Corporation for Aging, or PCA. And again, really the role is to provide for these individuals. They may need supervision. Maybe that's with their medication, or again, if they have a cognitive impairment, it is providing reminders, making sure that they're not left home alone, things of that nature. And there may be some assistance with activities of daily living, but that assistance may be limited. It may just be providing cues. It may just be providing setup assistance or reminders. It may not be more hands-on. It really depends on that individual, and that's certainly something that if you see someone who could be appropriate for this type of service, again, you can always talk with as Nick was alluding to, the local AAA, and see if that would be a fit for this type of individual. I believe that PCA is always on the lookout for those who are willing to be providers and offer their home to this type of service for individuals, and it's certainly definitely needed. So then a larger form of DomCare would be personal care boarding homes. Now, personal care boarding homes, these are typically homes. They are, again, licensed by the Department of Human Services, so there's certain expectations that these providers are supposed to be meeting. And typically the residents that you see in these types of homes, again, they need some structure, whether that is some assistance, light assistance with their activities of daily living. They may need some supervision. Maybe it's reminders to take medications or reminders to go to certain doctor's appointments. It could also, but they typically do provide all those IADLs that Nick was talking about. So it's making sure individuals get their meals, making sure that their laundry is taken care of, making sure that it's that they are those secondary things, usually the cleaning is taken care of for them. So so again, this is in terms of individuals who will need some assistance, but it's more or less, the assistance is more in terms of getting the help for those IADLs and maybe some ADLs and medication management, et cetera, and also management for their chronic conditions as well. So when talking about adult day centers are typically places for individuals. Maybe they have dementia, could be Alzheimer's type, any number of form of dementia, could be they have a chronic condition and they need supervision during the day. So these are, I always think of these as a kind of a step above a senior center. And the reason that I said that, because adult day centers have very structured activities in terms of what those participants are going to be doing for that day. So they may have exercise in the morning, they may have a program, they'll have lunch usually, and there are aides there. There's therapeutic intervention. Some adult day centers have sometimes have visiting physical therapists or occupational therapists that come if an individual is, was needing that, depending on their situation. There's aides there that are trained for those, maybe they need assistance getting to the bathroom, so that those individuals are there to help them do that. It's a pretty controlled, as the slide alludes to, it is a fairly controlled environment, and it is really a nice outlet for individuals, especially if they have a cognitive impairment, that if they want to live in the community and stay in their home or live with their relative, for those relatives or caregivers that work, this is an alternative for those individuals to get out, to socialize. We talk a lot about the impact of what social isolation can do to individuals and the harmful effects it has. This is a way for people to get out. They have structure to their day, especially in dementia, that is so important for those individuals. And this is, care that, and it could be respite for a caregiver as well. So and they're also licensed as well. So, there's certain set of standards they have to abide by. Okay. And so moving to that, you have these life care facilities. Now, the life, I would say, again, is a mix of community-based and facility. The facility is more that adult day center type of the facility. And the difference between electing life or the waiver program for someone who has, significant long-term care needs and maybe chronic conditions, life is that all the services are provided by one provider. So in Philadelphia, you have New Cortland Life. You also have Mercy Life, and they serve different parts of Philadelphia. So when someone joins the New Cortland Life program, their doctors, their medications, their physical therapy, their services, all those services come from an associated New Cortland provider. Now they contract out with different hospitals and different providers, that are affiliated with the, medical networks here. But I mean, at the end of the day, they all contract with New Cortland. One of the things that to qualify for life is that a person has to meet the nursing facility level of care requirement. And basically that means that if someone has a deficiency in either two or more activities of daily living, or they have a chronic condition that continually needs to be monitored, that is the federal standard in terms of nursing facility level of care. There's also, now depending on, which we'll get into a little bit, who pays for these types of services, that may depend on, the financial, a person's financial situation. The other thing too, another thing about life is that typically life is served to those who are 55 and over. So that's another thing to take in consideration when talking about the life program. So assisted living is sort of the assisted living and personal care homes are licensed the same way in Pennsylvania. Again, assisted living offers a lot of assistance when it comes to those IADLs and helping individuals manage that. So again, cleaning, grocery shopping, laundry, etc. It may help with medication management or some light activities of daily living. Often, though, you'll see assisted living, there's certainly standalones, but then you also see it wrapped in what's called like continuing care retirement communities. So maybe it's a community that has independent living, they have assisted living, and then they have nursing facility. Oftentimes individuals will pay a fee to enter, and a lot of times too, when it comes to assisted living, those providers may have their own assessment in terms of, what if this is an appropriate setting for them. Some assisted livings, you have to be able to manage stairs. Some, may not be. It really depends on that facility. Oftentimes when it comes to assisted living, especially when it comes into play with a continuing care retirement community, there's not assistance out there. They don't take medical assistance. A lot of times these are private pay, so they can get expensive for individuals. So then when we come in terms of the most restrictive type of environment, we think of nursing facilities. Again, it's a 24-hour, 7-day-a-week supervised services. They can assist with not just managing someone's IADLs and medication management, but now they're getting more into assisting individuals with those ADLs, so bathing, dressing, grooming, toileting, transfer. They'll look at an individual's diet. Do they have to be a low-salt diet? Do they have to be a low-sugar diet, maybe due to diabetes? Will they need their foods? Do they have any breathing issues or swallowing issues that a person now needs their foods softened or just pureed? There's a number of things that can be done. Oftentimes there is physical therapy and occupational therapy that are done in these facilities. They can be, and the facilities can serve not just as a long-term placement for individuals, but but often it is served as sort of a short-term stay. So let's say someone they had a fall, they had to get a hip replacement. This could be, if they don't have the supports at home, this could be a short-term stay for an individual to get the physical therapy and occupational therapy they need, ensure that they're medically being kind of monitored as they're recovering, and typically they're going to they may stay for a short period of time to help them get back up to where their baseline was and being able to go back home. So sometimes it can serve as a short-term intervention for individuals, and sometimes it has to be a long-term intervention, just depending on what that individual's needs are at the time. So I alluded to a little bit with talking about assisted living that there's different ways, and Nick talked about this too, of how long-term care is paid for in Pennsylvania. So first obviously is private pay. Individuals can pay privately for these types of services. There may be restrictions in terms of, for example, if someone had wanted to hire a home health aide through a home health agency to help come to the house, there may be there may be a certain number of hours per week that they have to hire that individual. Also, nursing homes too, that's private pay. Assisted living we had talked about is mostly private pay. So that's something, that's certainly, if folks have the means to do it, that is an option. Of course, talking about the homelessness population, that's often not the case. Some folks also have long-term care insurance policies. Now, this is different from Medicare and Medicaid or your supplement to Medicare. These are separate policies that individuals will take out, and it alludes to, okay, if someone meets a certain criteria, depending on the policy, maybe they have a deficiency in certain ADLs, or their doctor now sees them as they have cognitive issues. The long-term care policy may start kicking in, and that could either maybe pay for a certain amount of care each day through a home health aide or through a nursing home. It really depends on the policy that that person had taken out. And again, typically you're going to see individuals, because these policies can be expensive, folks who just they have more means, they're the ones who are going to be able to, you may see these more often. When talking about the in-home support services program, there's a couple different scenarios. It could be through what's called the options program here in Pennsylvania, or the waiver program, and I can talk a little bit more about that. And then we have the nursing home, which is medical assistance nursing home grant. Okay, and I got more into some of these types of payments than I intend to, but obviously, as you can see, private pay, you pay it out of your own pocket. With long-term care insurance, it is, again, it's a private insurance product. Again, you're going to an individual is going to go through a broker typically, or through a company to get these different types of policies. In fact, I had talked with a relative, and she's weighing about the idea. She's in her early 50s, about whether or not to get a long-term care insurance policy. Again, the policy, it depends on what it is. It could provide services for in-home supports, or it could be for in a nursing facility. It usually has a certain dollar amount that it will max reimburse an agency. And, one of the things is that it's, unless the policy doesn't typically restrict, like, well, what agencies can you get services from? So there is some freedoms in terms of what individuals, who they can use as their provider for services. If you were looking for more information for long-term care insurance, there's some federal websites that we list here. I would also recommend the State Department of Insurance. The Department of Insurance in Pennsylvania. They also have some information on long-term care insurance if anyone was interested. So in talking about the waiver program and in-home support services, what Nick was talking a little bit about earlier is that this is a program, it is paid for by Medicaid, and it is for individuals who meet, there's two kind of areas that they have to meet. There's a clinical criteria and there's a financial criteria. So the clinical criteria is that they meet that nursing home level of care. So it's either 2 or more activities of daily living, or they may have like a chronic condition that they would need skilled care for. So that's typically the clinical criteria to meet when it comes to the waiver program. And then there's a financial piece. Now the clinical piece, that is assessed by your local area agency on aging. And Nick had said it's not a trained medical professional who's doing these assessments, but they're trained in doing the assessments themselves. Oftentimes a nurse is reviewed, I shouldn't say often, it's all the time. A nurse then reviews that, and then it's reviewed by a supervisor. So there's a couple different levels. The other thing too is that a doctor would need to show that that individual, that they meet this criteria as well. So they, oftentimes there's going to be, it's good to know who is an individual's primary care doctor, because there's going to be a form that that doctor would need to fill out. Then there's financial requirements, and that's all done through the county assistance office here, by the local one here. And so if you're applying in Philadelphia County, the Philadelphia County Assistance Office is the one who's going to be reviewing the financial criteria. So for someone to get the waiver program, and I should note, there's a number of different waivers. I'm going to be mostly talking about the aging waiver, just because that's for individuals 60 and over. That's the population that we most work with. So with the aging waiver, typically the maximum monthly income for an individual has to be a little bit under $2,200. That's Social Security, that's a pension, that's interest on an annuity. That's their max monthly income. The assets is around $8,000. So that's what the county assistance office is looking at. Now, there are times when you have a married couple apply, like basically a person is applying and they're married. There's some other things to consider, but this is the thing to think of, is that this is the monthly income, not for the married couple, but for the individual who is applying, who is in need of these services. We'll talk more about what happens to the spouse a little later on. So if an individual does not meet the clinical criteria or the financial criteria for the waiver program, they may be recommended for the options program. Now, again, this is a program that could provide services in the home, and it's a number of different types of services. It could be getting assistance for activities of daily living, or those instrumental activities of daily living. Typically there's care management, which is someone coordinating these services. There's also could be some durable medical equipment, which is limited. It could be an emergency response button. There's a number. It really depends on what does that person need when they are assessed, and also when the care plan is being developed. Now, there potentially could be a cost. Depends on the amount of services that an individual is getting, and also what their income is. And I have seen that this program is a little more limited compared to the waiver program. So there may not be as many available services or as much amount of time available. Currently, right now in Philadelphia, there is, close to 2,000 people who are on a waiting list waiting for these types of services. So it is in demand. There was, a couple of years ago, an effort to bring those numbers down, which there was. Unfortunately, the population is aging, and there are needs for them. And the goal is, again, in trying to keep them in their home. So this is one of the unfortunate things about the program, is that it is a very high in demand program, and there is a waiting list for it. So if you were to come across an individual and you're not sure, well, I'm not sure if they would be appropriate for options or waiver. Are they, nursing home eligible? Are they not? That's really more of the job, again, with the clinical criteria, is for the assessors and their doctor to figure that out. But this is more or less to give you an idea of what type of settings are available, and kind of give a broader picture of what could be appropriate for a person. When it comes to, these types of services, especially if an individual does not have their own means to pay for it, the first step is to make a call over to Maximus. Now, Maximus is the independent enrollment broker, and they're the ones who sort of coordinate the application process between PCA in Philadelphia, if PCA, who's doing the clinical piece of the assessment, and then you have the county assistance office who's doing the financial portion of the assessment. So typically what happens is an individual or a caregiver might give a call over to Maximus. They have a discussion about what that individual needs. If that person on the phone thinks that they could be appropriate for the waiver program, they're going to send out a packet to them, and that's going to have an application for medical assistance. They're going to send a form to their primary doctor to see if it's appropriate that, does the doctor think that they have the needs that meet nursing home criteria? And then also, they're going to send a message out to the local AAA saying, we have this individual who needs to be assessed. and then that individual will be contacted by a local AAA assessor. That sort of kind of starts the process, excuse me. There have been hiccups in this process, and that's where, I like to kind of plug CARIE line. We have helped individuals who, they started the application process for waiver, they then suddenly didn't hear anything from anybody. We would call over to them to Maximus, only to find out that the doctor never sent in the form that showed that their nursing home facility clinically eligible, or Medicaid via the county assistance office had closed the case because they had asked for a bank statement and they never got it. So one of the nice things about the waiver program, there is currently no waiting list for it, but the application process can take months, and it's very important that there is someone to at least stay on top of what might be going on, because people lose things. Again, there have been issues with this process. So we have been successful in helping applicants get these services, but I just always like to warn people that it can take some time to get these needed services. Once the county assistance office does their review and if proves it or not, and the clinical portion is met, typically then a representative from Maximus comes out. They do a more in-depth assessment in terms of how people are managing, again, those activities of daily living, somewhat similar to what that initial assessment was. They may ask for what medications a person's taking, how are they managing their medications, any mental health issues, cognitive issues, etc. It's a little more detailed. Once they will then look to see about service coordination. The individual can choose for their service coordinator. Basically, who is the person going to be managing all of the services in the potential care plan, and then the care plan would then be sent to the Office of Long-Term Living, which is part of Department of Human Services, with approvals. And then once that's done, then a person starts receiving services. So it gets a little complicated and again, there are unfortunately opportunities for hiccups to come up. So people are probably asking, well, where does Medicare kind of come into nursing facilities or in-home support? So with Medicare, it is a short-term option for individuals if they have Medicare. Not everybody has Medicare. So if someone has Medicare and they have a qualifying hospital stay, now that means that they've been in a hospital for either 3 days or 2 midnights, they can potentially get some skilled services through Part A. So that can be up to, typically in a benefit period that is up to 100 days, a skilled nursing facility, again, or it could be services in the home. It depends on what would be the appropriate setting. The skilled care has to be necessary that was needed after that qualifying hospital stay. Typically, Medicare is going to be looking at how that person may be progressing, and now there is in the Medicare world, there used to be a standard on that a person had, if they plateaued, for example, they're not continually progressing, Medicare may say, well, we're not going to keep paying for these services. There's been some, which is a whole other presentation, but anyway, that's something that it's really not, it really more is important. Is this not so much that they're progressing, but if they don't have these skilled services, are they regressing? So that's really the key to be looking at. But the 100 days, that time, the time frame, that's not appealable. So I've met individuals that, they still need it. They unfortunately ran out of their skilled nursing days, and that's why why Medicare had to stop paying for those facility services, or skilled services, I should say. Now, the medical assistance nursing home grant, or Medicaid nursing home grant, basically, now this is the same financial application process, whether or not one is going through the Waiver Program or the Life Program to get their services, or they're going to be in a facility long term. So essentially, the County Assistance Office is going to be looking at that individual income. Again, are they under that $21.99 per monthly income? Are they under that $8,000? They also look at, there's this idea called spend down. So if someone has significant, significant savings, while maybe right before they were applying, how do they spend down that savings? One of the reasons that the federal government, through a law about 10 years ago, instituted this 5-year look back, was that they didn't want individuals who had enormous amounts of money just giving their money away and then qualifying and then applying and qualifying for medical assistance. So there is a question in that application of what did this applicant either sell a home or gifted or transferred money, a significant amount of money within 5 years, because that's the look back period. Also, for those who qualify for medical assistance, they could be subjected to a state recovery. Now, the State Recovery Act, and this is something that can be controversial with individuals and families. It depends on, I think, sometimes how it is presented to individuals is not the correct way. The way to describe it is that if someone had qualified for medical assistance to pay for long-term care in their home or in a nursing facility through Medicaid, when that person passes away, the state could look at that person's estate when probate is filed, and the state may say, well, we paid for this X amount of dollars in care. We think that we should recoup some of this person's estate. Now, oftentimes that could be through a sale of a home. Again, we do, in CARIE, we get calls about a state recovery. I usually let people know there is, through the Department of Human Services, there's a great guide on a state recovery and sort of what it is and what it isn't. When you hear folks, I don't characterize it as the state is going to come and take your house. That's not always the case. There are ways to get that a state recovery can be avoided, and that is where, again, you can talk with Department of Human Services, or a person can talk to an elder law attorney if they were really concerned about ensuring that, well, if they wanted their home passed along for their children. But that's just one, just so there's some information on that. What are the things that are, again, I don't want to get too much into the financial part of the Medicaid nursing home grant, just because, CARIE's not the one who's approving or disapproving people for for these types of programs. That's the County Assistance Office. But some of the things they may look, things that they are not going to look at, they're not going to look at, your house, if a person has a car, if someone has a burial fund, or depending on the value of a life insurance, if it's not that much. So these are called the non-countable resources. And again, individuals may not really have a lot of that. So talking about, again, just the spousal impoverishment standard. So again, one of the things that the County Assistance Office is going to look at is that if there is a married couple, a person who, one of the spouses needs this type of care, the goal is to not leave the community spouse poor and unable to maintain the home that this couple have shared. So this is this is a way for them to ensure that when they're doing these calculations and looking at if a person qualifies for these types of services, that that the person who is at home is still able to maintain, paying for the house, paying for the taxes on the home, things of that nature. And again, there is a max income limit that a spouse can have, but that's significantly more than what the person, than the individual who is applying for these types of services. Again, if you would like more information on estate recovery, or if you have individuals who, again, I know many of you are probably working with individuals who don't have a home, but if there's, if you run across of this, there is some resources out there when it comes to the estate recovery. And these are all under the Department of Human Services, but they have different telephone numbers for that. So, and this is just some information on Nick and myself. If you need to get in touch with us, if you were to have questions or individual cases that you'd like to run by us, just to let you know that we're available to you with help with the population that you're serving. I think oftentimes that, again, I hope this is helpful, that in explaining the types of environment that people can get long-term care services. Sometimes if you're not sure, you can, before you make that call to Maximus or the area or to PCA, you can give us a call and see, what would be, what you think, just asking what would be an appropriate setting for an individual that you meet. As an aging professional, I'm always looking at what is the least restrictive environment for this individual, and always, you're trying to advocate for community. That's, of course, sometimes that's not always the answer. It really depends on the individual's needs and what's going to keep them most safe. So I always, we always welcome questions, and if you'd like more information about these types of services, or again, because we obviously didn't get into everything, please I can just let you know that we are out here to be a resource for you. Nick, did you have any more to add?
I was just going to say, very well said. A big part of what we want to accomplish moving forward is making sure that we, as you said, are available for kind of that, to provide assistance with not just this, but any aspect of dealing with or working with an older adult population that you may have questions with, or maybe you don't feel comfortable with a good referral. We just want to make sure that you're aware that we are available, and we're aimed and hoping to make ourselves of value to organizations working in this area that also happen to work with older adults. But yes, so that was kind of my little tidbit.
I think that's well said also. So thank you everyone who joined in this webinar recording today, and we're hoping this could just be the beginning for bringing some educational materials to help serve those who are aging and who are homeless. And we just appreciate your time. And again, if you have any questions, feel free to reach out to us, and have a good day.
Thank you.